Hello and welcome. We're medical students from the University of Sharjah, and this is our research presentation on the relationship between active aging and quality of life in middle-aged and older adults in the UAE. To set the scene, the world is aging. By 2030, the number of adults aged 60 and above is expected to reach 1.4 billion globally. As populations grow older, there's a well documented decline in physical, mental, and social well being, which makes quality of life a critical public health concern. The UAE is no exception to this global trend. In fact, recognizing the urgency of this issue, the UAE has launched its National Framework for a Healthy Aging 2025 to 2031, which focuses on holistic healthcare and psychosocial support to improve the quality of life for its aging population. Now, a key concept in aging research is active aging, a term defined by the WHO as the process of optimizing opportunities for health, participation, and security in order to enhance quality of life as people age. Active aging encourages individuals to remain physically active, socially engaged, financially secure, and mentally well. Despite the growing importance of this topic, no previous studies had explored which specific active aging components significantly impact quality of life among middle-aged and older adults within the UAE context. This gap in the literature is exactly what motivated our study.
Our study had three main aims. First, we examined the relationship between active aging and quality of life among adults in the UAE who are aged 40 and above. And secondly, we explored how key components of active aging, such as physical activity, such as security, participation socially, as well as education, how it can all relate to different aspects of quality of life, such as mobility, self-care, usual activities, and discomfort, as well as mental health. And thirdly, we compared outcomes between UAE national and expatriate. For the methodology, we conducted a cross-sectional study that was done among UAE residents aged 40 and above. Participants were recruited using convenience sampling method from public locations such as mosques, hospitals, parks, University of Sharjah, as well as other universities and schools. And the survey was also distributed online through social media. The minimum sample size was 280 participants, and this was calculated using a formula but comparing UAE nationals and expatriates, and the values were derived from a similar study that was conducted in South Korea. And the data was collected using a 27-item validated questionnaire with three sections: demographic, active aging, and quality of life. As for the quality of life assessment, we used the EQ 5D5L tool, which was developed by Eurocall, to evaluate 5 dimensions: mobility, self-care, usual activities, pain or discomfort, and anxiety or depression. Participants also rated their overall health using EQ VAS on a scale from 0 to 100. As for the analysis, we used SPSS version 29, applying the Man-Whitney U test, Kruskal-Wallis test, Spearman correlation, and hierarchical regression, with significance set at a p less than 0.05. And finally, ethical standards were fully maintained. Participation was voluntary and anonymous. No personal identifiers were collected, and all data was securely stored on a password-protected device.
We successfully recruited 532 participants in total, exceeding our minimum required sample size. Demographically, we had 70.9% females, 90.8% were aged 40 to 59, the rest were 60 and above, 67.5% were UAE nationals, and 77.1% were university educated. As for lifestyle and health factors, 79.7% had never smoked, 79.5% were at least sometimes physically active, 70.5% reported sleeping more than 6 hours per night, while 62.8% had no chronic diseases, 69.5% had no physical limitations in daily movement, and 87.4% had never been diagnosed with depression, though 46.3% did report some degree of anxiety or depression via the EQ5D5L tool. The mean EQ index score was 0.865 out of a maximum of 1, with a standard deviation of 0.161. indicating an overall good quality of life across the sample. The EQ-VAS mean was 68.44 out of 100, though with considerable variation. When comparing UAE nationals and expatriates, UAE locals reported significantly higher quality of life, with a median EQ index of 0.925 compared to 0.890 for expatriates, and this difference was statistically significant at p equals to 0.001. Our hierarchical regression model explained 46.0% of the variance in quality of life scores. Health-related factors alone accounted for 29.6% of that variance, making them the strongest block of predictors. The most significant predictors of better quality of life were absence of physical limitations, lower stress levels, fewer chronic diseases, higher education levels, and absence of a depression diagnosis. Other significant factors included being a female, being a UAE local, sleeping more than 6 hours, being physically active, having healthcare access, and being employed. Factors that were not significant predictors included marital status, having children, and smoking status, which was a noteworthy and unexpected finding we will address in the discussion.
Our results broadly support the hypothesis that active aging is associated with better quality of life, a finding consistent with global literature. The strong association between physical activity and the absence of movement limitations with higher EQ index scores aligns with research by Lin and colleagues in 2020, who found that physically active middle-aged and older adults tend to age more successfully than sedentary individuals. This reinforces the fundamental principle that staying active is one of the most powerful tools for preserving quality of life as we age. The significant role of stress is also noteworthy. Higher stress levels were among the top predictors of lower quality of life, which highlights the need to address mental well-being alongside physical health in any aging-related public health strategy. One of the more surprising findings was that smoking status was not a significant predictor of quality of life in our regression model. This contradicts the findings of Zong and colleagues in 2025, who found higher quality of life scores in moderate smokers, and Rezai and colleagues in 2017, who reported lower scores in current smokers. This inconsistency may be partly explained by the relatively low proportion of current smokers in our sample, only 11.5%, which may have limited statistical power to detect meaningful difference. The nationality gap in quality of life, with UAE locals scoring higher than expats, is another meaningful finding. This could reflect differences in social support, networks, financial security, cultural sense of belonging, or access to public services between the two groups, and warrants deeper exploration on in future research. Limitations. First, small number of participants who rated their health as excellent, 8, may have led to unstable regression estimates that end of the scale. Unequal distribution across gender and nationalities may have introduced some bias. And lastly, the convenient sampling approach reduces the generalizability of our findings to the broader UAE population.
In conclusion, our study demonstrates that active aging factors are significant predictors of quality of life among middle-aged and older adults in the UAE, explaining 46% of the variance in quality of life scores. Health-related factors emerged as the strongest block of predictors, accounting for nearly 30% of that variance on their own. These findings carry important implications. They tell us that modifiable factors, particularly physical functioning, stress management, chronic disease burden, and access to healthcare, are key levers through which quality of life can be improved for this population. Based on our findings, we put forward the following 4 recommendations. Enhance structured physical activity programs targeting middle-aged and older adults, with a specific focus on reducing physical limitations and maintaining functional independence. Improve access to mental health services, particularly for the management of stress and depression, as these were among the strongest predictors of poorer quality of life. Promote adequate sleep and stress management strategies through community-based initiatives, given their significant associations with better quality of life outcomes. Conduct future longitudinal research to move beyond associations and explore causal relationships, and investigate the cultural and social factors, including the unique experiences of expatriate communities that influence active aging and quality of life in the UAE. Thank you for watching.